My name is Bumi Adeberge. I'll be your nurse practitioner today assessing you. What's your name?
My name is Kay.
Hi Kay, why are you here today?
I'm here because my knee hurts.
Oh, I'm so sorry about your knee. We're gonna see how we're gonna help you with your the knee today. While I'm doing that, I'll be asking you some questions. I'll be checking you from head to toe. At some point, I'll be laying my hands on you. If there's any point in time you feel uncomfortable with this assessment, just let me know and I will adjust accordingly. Okay? And you have the seat right there. I'll be having my seat right here. Okay, so before we start, can you tell me your age?
I'm 41 years old.
41 years old. And you say you have a knee pain, right?
Yes.
When did it start?
Started 3 days ago.
3 days ago. How did it start?
I was playing soccer with my friends and I got kicked in the knee.
Oh, so sorry about that. So is this on the left or the right knee?
My left knee.
Left knee. How would you describe the pain? Is it throbbing, aching?
Initially, when I got kicked, it was really sharp. But within the last 2 days, it became dull and achy, and it's present almost throughout the day.
Okay. On a scale of 0 to 10, 10 being the worst pain, how would you rate the pain?
6, please.
Okay, 6. Is there any other associated symptoms with this pain, like fever, chills?
No.
Okay. Is the pain radiating to any part of the body, any other pain somewhere?
No.
No. Okay. Is there anything that makes this pain better, like relieving factor?
When I take paracetamol or Tylenol,
Okay.
it relieves temporarily.
Okay.
But when I put ice on it, there's temporary relief.
Okay. Is there anything that makes it worse?
Anytime I bear weight on the leg, it's painful. Or try to bend the knees, it's painful.
Okay. Did you say you use any medication already?
I use Tylenol
Did
and
that
I
help?
have temporary relief.
Temporary. Okay. Sounds good. I'm just gonna go quickly to your past medical history. Have you ever been sick at any time or hospitalized?
Yes.
Okay. What was that?
2 years ago,
Good. What happened then?
I was diagnosed of kidney stones,
Kidney stone.
and I was hospitalized for about 2 days.
2 days. Were you on any medication at that point?
Yes, I was on medications.
Okay. And what medication is that?
I was given analgesics to relieve the pain. Then I was also given some medications to help with the stones, but I can't remember them now.
Okay, sounds good. Is there any other medical condition you're managing currently?
Yes, I'm a non-peptic ulcer disease patient.
Okay.
I take omeprazole 20 milligrams daily.
Omeprazole. Is that the only current medication you take right now?
Yes, that's the only medication I take.
Do you have any allergies to food, medication, and environmental factor?
No allergies.
No allergies. Talking about immunization, do you think you completed your immunization when you were a child?
Yes, I did. And I have documents to back it up.
Okay, sounds good. Have you had a flu vaccine this year?
Yes, I've had flu vaccine. I think I had it last week.
Okay, September 2024.
Yes, September.
Yeah, September, right?
Yes.
Pneumonia vaccine, how about that?
No.
Okay. And COVID vaccine?
I've completed my COVID vaccination.
Okay, sounds good. Have you had colonoscopy done before?
No.
Okay. How about eye examination?
Yeah, I do my yearly eye exams. I did the last one in August at Clear Vision Clinic. Dr. Bright was the one that saw me that time.
That's August this year?
August this year.
Okay, how about dental examination?
I believe that was a month before that. That should be July. At Great Smile Clinic.
Okay, Great Smile.
Yes. And it was Dr. Babs that I saw at the time. Yeah.
Okay, sounds sounds good. Seems like you've been keeping up with your yearly examination, and that
Yes.
sounds good.
Yeah.
Okay. Now I'll be asking some questions about social history. I
Okay.
need you to give me a little bit of information about your living arrangement, okay?
I live with my wife and son.
Mm-hmm.
We live in a 3-bedroom apartment in the heart of town.
Okay.
I can say we're pretty comfortable.
Okay.
Yeah.
You guys have pets?
We don't have pets.
Okay, no pets. Okay, about your job, what kind of job do you do?
I'm a civil servant.
Okay.
I work with the state government.
Okay.
And it's been pretty awesome.
Okay. And how many hours a week you work?
I work 40 hours a week and I work day shifts.
Day shift, okay.
Yes.
Any work-related stress or occupational hazard?
Oh yes, I mean every work comes with its own stress.
Yeah.
I drive to work almost on a daily basis for an hour and a half or 2 hours sometimes.
Okay.
And that is stressful.
Okay.
In fact, it's actually contributed to the hazards that I think I'm seeing at the job. Because spending so much time on the road is,
I know, right?
can be discomforting. Yeah.
Okay. Have you traveled? Do you think you've traveled outside the country in the last 3 months?
I haven't traveled outside the country.
Okay. So, what's your sleeping pattern like?
Well, I sleep fairly well. I think I do about 7 to 8 hours of sleep every day.
That's good. How about exercise?
Yeah, I do well with exercise as well.
Okay.
I do a 2-mile run every morning.
Okay. That's good. And do you smoke?
No, I don't smoke.
And do you drink alcohol?
No, I don't.
Okay. That's good. And then I'll be moving fast to your family history.
Okay.
I need you to tell me about your parents, their age, and they're well and alive. There's any family history of any medical condition, okay? Any infectious disease, a psychiatric illness in your family. I want to know to the level of your grandparents, okay?
So my dad is 76 years old. He's known hypertensive.
Yeah.
My granddad is deceased, he's late. He's a known hypertensive, but he wasn't compliant with his medications, so we lost him when he was about 92 years old due to hypertension complications. My grandmother from my dad's side, she died when she was 86 from natural causes. My mom, she died when she was 40 due to pregnancy complications.
Oh, so sorry about that.
And my mom's parents, which are my grandparents on my mother's side, they are both deceased. My granddad was 76 when he died. My grandmom was 74. We both lost them to a road traffic accident.
Oh, wow.
Yeah.
That was really love for you guys. Okay. How about your siblings?
I've got 3 other siblings. One is 48, female. She's also a non-hypertensive. She's compliant with her medications. I have a 37-year-old sister who is alive and well. No history of psychiatric illness or any other illness in them. I have a brother as well. He's 30. He's alive and well. So in all of us, we don't have any history of psychiatric illnesses or infectious diseases.
Okay, sounds good. So I'm going to be moving on to review of systems. We're gonna be checking, asking questions, assessing from head to toe related to this shift condition that you're experiencing right now. Okay. Just gonna ask if you have any history of fever, chills, lethargy, or night sweats.
No.
Okay, none of those. Any history of headaches?
No.
Loss of consciousness?
No.
Head injury?
No.
Dizziness?
No.
Okay. Any history of blurred vision?
No.
Okay. Eye pain, eye discharges?
No.
Ear pain, ear discharges?
No.
Any history of contact lenses or glasses?
No.
Any history of nosebleed?
No.
Bleeding from the gums?
No.
Sore throat?
No.
Difficulty swallowing?
No.
Okay. Any history of shortness of breath? Cough?
No. No.
Okay. Any history of palpitation?
No.
And shortness of breath on exertion?
No.
None of those. Any history of heartburn?
Yes.
Okay. Heartburn from your
Yes, I do
right?
have heartburns once in a while,
Okay.
and once I take my meprazole, I feel better.
Okay. How about history of nausea and vomiting?
No.
Any change in bowel movements?
No.
Okay, when was your last bowel movement?
This morning.
Okay, sounds good. Any history of frequency or urgency urination?
None.
Okay. History of excessive urination at night?
No.
Okay.
No pain urination. I don't have that.
Okay. Any history of abdominal pain?
Nope.
Okay. Any history of penile discharge?
Nope.
Okay. No. Any issue of weakness on your extremities, numbness,
No.
or tingling?
No.
Anywhere?
No.
Okay, no. Any issue of skin changes, deformity?
No.
Okay, any issue of itching?
No.
Okay, sounds good. Sounds good. Moving on to the physical assessment, okay? I'm gonna be washing my hand, cleaning with my sanitizer, and I'm going to be testing for a short time and long time memory. I'll give you some words for the short time memory, and I would like for you to recall at the end of the assessment.
Okay.
So for the short time memory, you're going to remember happy, baby, smile. Okay.
Okay.
So for the long time memory, you're going to try to remember the name of the two past presidents of the United States of America. I mean the past and the current one. Okay? So have that in mind.
Okay.
So, okay, moving on, I'm gonna be checking your skin, looking at your skin and the way you're sitting down, you're in good posture, there's no sign of distress, there's no sign of obvious deformity, and then your skin is intact, everything looks good, and checking your skin is warm and is dry and intact. I'm checking your skin for lesion, there's no obvious wound. And if there's any lesion, I'll check for the size, the shape, I'll measure it with a ruler, measure the diameter with a ruler. I'll also look at it with magnifying glasses, noting the length, the width, and if there's any elevation in diameter. I want to also check if there's check the pattern, the distribution, also check for the location, there's any exudates and any odor. I want to check the color of the exudates. But right now, there's no lesion, okay? And coming down to your nails and the nail bed, I see that it's pink and it's intact, and also capillary refill is less than 3 seconds right there. And checking your, so let me check for clubbing. So fold your hands for me. There's no sign of clubbing, and I'll just be checking for stereognosis. I need you to close your eyes. Close your eyes. And then I want you to feel what's right here.
Okay, so battery.
And I want you to feel what's right here.
This is a coin.
Okay, it sounds good. Now I'm gonna be checking for the pulses, radial pulses, bilaterally, it's present, and 2+ bilaterally, okay? I'm gonna be checking for the brachial pulses, one at a time, it's 2+. Present, and it's 2+, okay? So that's good. Now I'm gonna be checking for the epitrochlear nodes right here. There's no enlargement. And checked on the other hand, there's no enlargement. As well as checking for your axillary nodes. There's no enlargement as well, everything is normal. Okay, and then I'm gonna check for range of motion for your wrist, for your elbow, and for your shoulder. For your wrist, can you do this and do this and out? Okay, and for your elbow, can you do this? Take it down, and for your shoulder, up and down. Okay, sounds good. And now Okay, everything is good without range of motion. I'm gonna be checking your head. Alright, for your head, there's no lesion, there's no mass, there's no sign of obvious deformity. It is symmetrical. Your hair is black and it's evenly distributed. And checking your face. Your face is symmetrical. There's no enlargement. There's no obvious deformity, and everything seems normal. I'll be testing for the cranial F7 on your face. I want you to smile for me. I want you to frown your face, and I want you to puff your cheek. So cranial F7 is intact. So I'll be palpating for the temporal artery bilaterally. It's present, 2 plus bilaterally. I'm going to be listening to it with the bell of my stethoscope. Okay. Okay. Sounds good. There's no signs of bruit. I'm not going to be checking for the frontal sinuses and the maxillary sinuses, and I'll be percussing both bilaterally. Any pain?
No.
Okay, so there's no pain, there's no tenderness right there. So now I'm gonna be checking your eyes, and for your eyes, I'll check the orbit. There any pain? Any
No.
pain? So there's no pain or tenderness. Can you open your eyes wide? So looking at your eyes, the sclera is white, the conjunctiva is pink, and the iris is brown. Okay? So I'm gonna be checking for the cornea from side to side. So the cornea is clear, and I'll also be checking for the Hitchback sign on top of your nose. Okay, so the reflection to the light is symmetrical on both eyes. So that's good. So I'll just check for the direct and concessional pupillary response. So for the direct, I'll check on both eyes. I'll also do the concession from the concessional pupillary reflex on both eyes. Okay? Can you open your eyes for me? Okay, so the direct and concessional pupillary reflex are normal. And now I'll check for accommodation. I want you to look at the wall and then look at my finger, okay? And I'll do the cover and uncover test, okay? So, and then this one, okay. Open your eyes, okay. So, the pupil is round, accommodation is normal. Now I'm going to be doing the 6 cardinal view of gaze, which will let me know if the cranial nerve 3, 4, and 6 is normal. So what you need to do is just to follow with your eyes, follow the direction of my fingers, okay? So 3, 4, and 6, 3, 4, and 6. So the cranial nerve 3, 4, and 6 is intact. Now I'm gonna be checking from finger to nose. We're gonna be doing the finger to nose test, and I'm gonna be pointing on my nose and then put my fingers towards you. Then I'll point on your nose and then touch my finger. Okay? So can you put your hands on your nose? Touch my finger. Touch my finger. Okay. So finger to nose is normal. Okay? So now I'm gonna be checking your nose. Looking at your nose is symmetrical. There's no enlargement. There's no any obvious deformity. I'm gonna be palpating it, and I'm gonna be testing for patency. Can you blow? Okay, blow the nostrils. And let me check the blood. is normal. The nose is, the patency of the nose is normal. I'm gonna be checking the forehead reflex in your eyes, as well as the internal structure of the eyes, and then I'll check for the internal structure of the nose. Okay? So, so for the red reflex, I'm gonna be looking into your eyes. Okay. Okay. So now I'm gonna be checking for the internal structure of the eye. Okay. So please read it. Computer. So the retina, the optic disc, and the blood vessels are sane and normal. The retina, and the optic disc and the blood vessels are normal. Okay. Yeah, I've done the red reflex and the internal structure. So now I'm gonna be checking the internal structure of the nose. Okay. Okay. So have your hand lifted up. I'm gonna check. Okay, yeah. The septum is pink, moist, and intact, and there's no obvious deformity. Okay. There's no redness. And then I'm gonna check on this side. The septum is pink, moist, and intact, and there's no redness. Everything is normal. Okay. So I'm gonna be checking your ears. Looking at your ears, they're both symmetrical. There's no drainage. There's no discharge from the ears. The pinna of both ears is equal on the same level with the outer contours of the eye. And I'm gonna just be checking the internal structure of the ear, and then I'll do the whisper, the Weber, and the rhyming test. So I'll be checking and then stabilizing with the pinky finger. Okay. So the tympanic membrane is pale gray, and I'm able to see the bony structures with the light reflection. Okay, I'll check this for the ear. Stabilizing with my pinky finger. Okay. So the tympanic membrane is pale gray, and I can also see the bony prominence, the bony structures on the light reflection. Okay. So now we're gonna be doing the Weber test. So for the Weber test, I'm gonna hit this on my hand. It's gonna vibrate. I'll put it on your head. What I need to know is if you're able to hear the sound equally, the sound of the vibration equally on both ears, or you hear it differently. Okay? Are you ready?
Yes.
Okay. So we do the rhyming test. For the rhyming test, I'll also hit on my hand. I'll put this on the back of your ear, and then I'll also put it in front, close to your ear in front. Okay. What I'm trying to check for is bony conduction and the air conduction. Okay. I'll do that for both ears. Let me know when it stops. Okay, I'm gonna just repeat that for this other ear. Okay, sounds good. Okay, so the air conduction is twice as much as the body conduction, which is normal for your ear. That sounds good. Now I'm gonna be checking your mouth. Your mouth, looking at your mouth is symmetrical, is intact. There's no obvious abnormality. I'll be checking the inside of your mouth, okay? So you're gonna open your mouth wide and you say ah while I'm checking the inside of your mouth. Can you tilt your head backward a little bit? Stick your tongue out. Good job. I can see the heart pilot. There's no enlargement. There's no inflamed tonsils. I can see the vocal cavity is moist, pink, and intact. The tongue is moist, pink, and intact. And the teeth is symmetrical. Everything seems normal there. The next thing is, can I test for the strength of your tongue on both sides? On the left side. And can you stick out your tongue? Okay. Can you swallow? There's no pain, so there's no difficulty with swallowing. I'm gonna be checking the inside of your mouth. The gums. The gums are moist, pink and intact, and there's no enlargement anywhere. There's no enlargement anywhere. Okay? Okay, sounds good. Okay. So I'm gonna be checking your cheeks. There's no enlargement. There's no on here. Can you open your mouth or your jaw to check up and close? That's checking for the TMJ. Okay, temporomandibular joint, which is normal and intact. So now I'm gonna be checking your neck. Looking at your neck, it is symmetrical. Trachea is midline, and there's no enlargement. There's no any deformity. I'm gonna be palpating and checking for the carotid artery bilaterally, one at a time. 2 plus on this side, and 2 plus on this side. I'm gonna be listening to it with the bell of my stethoscope. Okay, there's no sign of bruit, everything is normal around there. I'm gonna be checking for lymph nodes, starting from the preauricular, postauricular, occipital, the tonsillar, the submandibular, the submental, the deep, and the superficial cervical, and then the supraclavicular. Sorry. Are you okay? I'm so sorry, okay?
That's alright.
Alright. So, do you want to use the sorry. So, and then the supraclavicular.
Okay.
So there's no enlarged lymph node, all the lymph nodes are good.
Okay.
So now I'm gonna do range of motion for your neck. I need you to bend your neck on this side, on the other side, ear to shoulder, then front and back. Okay, so the range of motion is normal and it's good. Okay, now I'm gonna be checking for the thyroid gland, and I'm gonna be checking from the back. Okay. Okay, so I'll have you turn your head to one side and then you swallow, okay? Okay, turn your head to the other side, a little bit more, and then swallow. Okay, so I could palpate the thyroid gland while swallowing. Okay. Okay, so now I'm gonna be checking your chest, okay? There's no pulsation and there's no sign of heaves. And I'm gonna be checking for the precordium. I'm palpating for it. And then the apical pulse. Okay. Then I'm gonna be checking the chest from the back. I'm gonna be checking your chest from the back. So looking at the back, there's no signs of heaves, there's no sign of difficulty in breathing, there's no sign of use of accessory muscles. The respiration is normal. I'll be checking for the respiratory retraction on both sides. I need to take a deep breath out. So respiration is even and equal on both sides of the lungs. Okay, I'll also be checking for the costovertebral tenderness. All right. Any pain or tenderness? Any pain or tenderness? Okay. Now I'm gonna be, percussing from the back. Yeah. Okay. There's resonance on percussion, which is normal. And now I'm gonna be checking. I'm not gonna be palpating. I'm checking for the fermitors. For tactile fermitors, what I'm gonna be doing, tactile fermitors, what I'm gonna be doing is to palpate and then you say 99, okay?
99, 99.
Okay, so the fermitors is normal, and now I'm gonna be listening to CBA tenderness, there's no tenderness. So I'm gonna be listening to the breath sound from the back, okay? So before listening to the breath sound, I'm gonna do egophony. So for egophony, you're gonna say E while I'm auscultating, okay?
E.
Okay, that's good. Egophony is normal. I'm gonna be checking for the breath sounds, okay? And I'm gonna take a deep breath in and out when I'm doing that. Again. Okay, breath sound is clear, and I'm going to check in bilaterally. 2 on the left and 3 on the right, okay? Okay, sounds good. So, there's resonance and percussion, which is normal, and the breath sound is clear. There's no sign of adventitious breath sound, and everything is normal. So, I already checked for your precordium and the apical pulse. and everything about your chest is normal. I'm gonna check for palpate it and check if there's any lump or mass.
Okay.
There's no lump, there's no mass. There's no lump, there's no mass. Okay. Okay. There's no lump, there's no mass. And I'm gonna listen to the breath sound of 4 points in the front. Take a deep breath. Okay, sounds good. Everything is normal. Okay, now I'm gonna be listening to your heart sounds. I'll have you lie down on there. While I'm doing that, I'll have you lie down in here. Sit on the center. Put your head on this side. Shut up. Come closer to me. That side. Okay, so I've been listening to the breath sound. So for the breath sound, I'll check for the aortic, which is on the second intercostal space, right sternum border. Okay. Pulmonic, which is on the second intercostal space, left sternum border. Okay, the Erb's point, which is on the third intercostal space, left sternum border. The tricuspid, which is on the fourth intercostal space, left sternum border. And mitral, which is on the fifth intercostal space, mid clavicular line. And this is the point I listen to the apical pulse, and I'm going to be counting for 1 full minute. So the apical pulse is 74 beats per minute, which is normal. And I'm gonna be listening for any sign of heart murmurs. I'll be listening with the bell of my stethoscope. I'll check it on the same points, okay? I'll check it for the aortic, pulmonic, Erb's point, tricuspid, and mitral. I can't hear any sign of murmur, so that's normal. And from there, I'm gonna be going to the abdomen. So from the abdomen, I'm gonna be checking from the right side, and I'll check. The abdomen is flat, symmetrical, and there's movement up and down with respiration. And can I have you raise your head up a little bit? Okay. There's no obvious bulge. There's no mass. Okay, there's no obvious bulge or mass. Okay, you can put your hands down. Okay, so I have to expose your abdomen, okay? So the next thing I'm gonna do is to auscultate and listen to the vowel sound on 4 quadrants, okay? So bowel sound is present, and now I'm gonna be checking for vascular sounds using the bell of my stethoscope. Aortic, renal, antibiliac, and then I'll check for the two femoral. Okay, that's good. Vascular sounds are normal. I'm gonna be percussing for quadrant. There's resonance, which is normal. There's no hyperresonance. And now I'm gonna be palpating. Okay. I would like to check for the scratch test, which is checking for the liver border. Okay. So I'll do that by listening. That's your right to hear, right? So, okay, so the liver border is right there, and it's just 1 centimeter below the last rib cage. Okay. Now I'm gonna be palpating, and I'm gonna do light palpation and deep palpation. Just tell me if you have feel any pain or tenderness. Okay.
Okay.
Any pain or tenderness? Okay, deep palpation now. Any pain or tenderness? Okay. I'm gonna be checking for your liver and the spleen. So the liver is gonna be on the right side. I'm gonna be checking the breath. Okay. And then I'm gonna be checking for the spleen on the left. Okay. Any pain or tenderness? No. And the liver and spleen are not palpable, so everything is normal there. Okay. So going to your lower extremities.
Okay.
I'll be checking for your legs. Everything is normal. The skin is intact. It's symmetrical. The hair is evenly distributed. There's no sign of any obvious deformity on the leg. I'll be checking for your femoral pulses. 2 plus bilaterally. I'll be checking if there's any inguinal node enlargement. There is none. And there's no pretibial edema, and then there's no, then on your toes, checking your toes, there is, it's pink, it's intact, and capillary refill is less than 3 seconds, okay? And I'll be checking for the dorsalis pedis pulse, 2 plus bilaterally, and the posterior tibia pulse, which is 2 plus bilaterally. And I'll be checking for range of motion and strength on the lower extremities. I just want you to wiggle your toes, and then push against my hands, and push against my hands, and then I'll be checking for range of motion on your legs. This is the right leg, right? So I want you to lift the leg up, down, to the side, back, and then place the and then on the shin down. Put on the shin down. Okay, so range of motion on the right leg, it's good. Then I'm gonna be checking for strength on the same leg. I'll have you raise the leg up a little bit, push against down, push up, to the side, out, and then in. Okay, and I'll have you raise from that, and then push down, push up. Okay, sounds good. Strength is good on the right leg. And then on the left, I'll have you raise this leg up a little bit. Yeah, I know you feel some pain on here because of the knee pain. So the okay, that's how far you can go.
Yeah.
Okay, to the side, back, and then can you pull it up, down? Okay. Sorry about that. Okay. The range of sorry about that. I'm so sorry. Okay. The range of motion on the left knee is reduced because of the knee pain. Are you able to put it on this leg? And do the shin down movement. Okay. It's still kind of reduced because of the knee pain. Okay. And I'm going to check for strength. Would you be able to do the strength?
Yeah.
Okay. Okay, push. Okay, push up, out, in. Okay, sounds good. Okay. And then push down, push up. Sorry, it hurts, right?
Yeah.
I'm so sorry about that. Okay, so now I'm gonna have you do the Lachman test. So for the Lachman test, I'm gonna just be checking for the laxity of the ligament here. Can you raise this leg up? And then I'm stabilized, so the laxity of the ligament is normal, right? So you can. I also have to check it on the other leg. And check this leg up. So it's also normal on the other leg. Now we're gonna be doing the McMurray test. So for the McMurray test, I will have you lift your leg up, do it out, up and down, in, up and down, which is good. So right here, you lift it up, out, up and down. It's kind of reduced on here. I understand because of the knee pain here, up and down. Okay, sounds good. Now I'm gonna have you sit, come down and sit so I can do the Appling test. So you're just gonna sit here and we do the Appling test. Okay, thank you so much. So for the Appling test, you're gonna go up, out and in, down, out and in. Okay, so I'm gonna raise it up, out and in, down, out and in. Okay, that sounds good. Now I'm gonna be testing your reflexes, both on the lower and the upper extremities, okay? Okay, so I'm gonna be checking for the patellar reflex, the reflexes, patellar reflex. Okay. Okay. And I'm gonna be checking for the Achilles reflex. Okay, sounds good. I'm gonna be checking the okay. So I checked the Achilles already. We're gonna be checking for Babinski reflex. So I'm gonna have this come over on this way. Okay, I don't see any sign of Babinski, which is negative. I'm gonna be checking your this is the tricep reflex, and then the radial reflex, and then the brachioradialis reflex. So you have your hand bent like it. Okay. And then the brachioradialis. Okay, sounds good. And have your hands bent. Okay. Okay, sounds good. So now, yeah, but good. So I'm gonna compare side to side. Okay. Okay, sounds good. Comparing side to side, everything is normal, okay? Yeah, so I'm gonna have you come down. So I'm gonna have you come down. I'll need you to walk, okay? So what you need to do for me is to walk normally towards the other side, and then when you're coming back, you walk on your toes, okay? So can you walk? Okay, you walk back on your toes. Can you walk back on your toes? Can you walk back heel to toes? Heel to toes. So heel to toes is normal. I need you to walk back on your toes. Walk back on your toes. Good job. And then walk back to me on your heels. Okay. Everything looks good. And I'm gonna check for rumbar test. Can you close your eyes and raise your head up? So there's no, everything is symmetrical. There's no drifts. Everything is normal, okay? I'm gonna be checking your back. So the spine, the curvature is normal. The spine, the curvature is normal. The cervical, the thoracic, and the lumbar curvature, everything is good and normal. And I'm having bender so I can check your scapula, the iliac crest, and the gluteal folds. It's aligned and everything is normal. Okay? And I'm having to do some spine movement. So I'd like you to bend to the back. Okay, sounds good. To the side and to the other side, front and back. Okay, and back. Okay, sounds good. The next thing I'll have you do is the shadow knee bend. The shadow knee bend. Okay, sounds good. That will be the end of the assessment. But I would like you to remind me the 3 words I told you at first at the beginning of the assessment.
Happy, baby, smile.
Good job. How about the long-term memory? I told you to remember the something.
President,
Yeah, the president.
Joe Biden, and Donald Trump.
Okay, good job. Thank you so much for your time and your patience, and that will be the end of the assessment. We'll see how we can help you and what we can do about your knee, okay?
Thank you.
Welcome.